So turn to the last page in your diabetes, because everything you need to know, I typed it already, personally for you. Yep, padunkadunk. Okay. Now, if you look here, it's all right there. All of it is literally right there. But we're going to have you highlight some things as soon as this baby gets hers. First of all, y'all already know that DKA is a type 1 issue, correct? Now you have to be aware that next to the DKA is something that may look confusing because it looks a lot like the one next to it. So if you look at this, it says HHKS. That stands for Hyperglycemic Hyperosmolar Ketones or Ketotic syndrome. Why would I put that on there? Not necessarily for you, but the NCLEX tries to trick you and write that shit to see if you're reading carefully. You don't have to know it. You got to know DKA. So that's what you care about. Across from it is HHNS, which will kill you faster. And this is two different people. It could be a type 2 diabetic, or it could be someone who may not have ever been diagnosed, but they're in the hospital with some seriously acute illness or just got surgery. Because what? Surgery and illnesses raise your blood sugar. Okay. Yes, ma'am. Steroids too. That's right, baby. Okay, so here we go, y'all. Let's go ahead and work that magic. If we look at the type 1 diabetic, I want you to put on there all of a sudden next to the words type 1 DM. It's all of a sudden down under DKA. All of a sudden. HHNS, gradual. DKA says high glucose level. You're going to put greater than usually 500. You know, some people say 300. I say 5 because if you call me ever on a 3, I'm going to kill you. Do not call doctors on 3s. Okay, but greater, unless they tell you to. But greater than 500, the little machine is going to say H because it's too damn high to register. That's a red flag. The little AccuCheck thing is going to say H. Okay, so greater, greater than 3, 4, 500. Okay, so y'all get it? Now, on the other side, what does it say instead? Oh boy. Yup, greater than 800. Can you see why you die faster with HHS? Because your sugar rolling around 800, 1,000, 1,200. The highest, I personally didn't see, but a friend of mine did, was 1,400. Oh, Doc, have you ever seen anything higher than that?
No, I've heard about it.
Yeah. You figure, how are they walking?
Huh?
You figure to yourself, how are they walking? Yeah. The highest I've ever heard from a very reliable source was at the VA, 1,400.
Actually, I saw a patient who was at the VA said his was 1,800.
Oh, see, the VA be doing big things.
He was literally dead, but he was. But
they brought him back. I believe that.
At the VA, but I haven't seen it
in the real world. Veterans can take any damn thing. Okay, now on the left-hand side, common sense. They have ketones, correct? And when we see the words acidosis, of course they have acidosis because the damn thing here says DKA, and the A is for acidosis. However, is that pH high or low? Taking too damn long to think about this shit. I'm coming around. You sound retarded. What is it?
Low.
Anybody trying to say high up in here? Get your shit together. Okay, so low pH. All right, so you got a low pH. Why am I asking you that? Because ain't nobody going to give you cookies and cream. They're going to do a gas for you. The patient will have a gas, and it's going to have a bunch of other symptoms. Okay. All right, so you got the little acidosis there. Is there any acidosis with HHNS? Why not? What, boo-boo kitty? What did you say, sugar pumper lumpka? I need somebody to tell me why this patient ain't got no damn ketones and no acidosis. They are getting half, but that doesn't tell me why they don't have. Now that's better. They're not breaking down what, nurse? Gone with your bad self. And what does the breakdown of fat do? What does it give you, boo-boo? Ketones and fatty acids. There's that word. I got to get y'all there with me, man. I'm serious. You got to understand that to the core of your being, that this HHNS patient has enough insulin that they're getting glucose from whatever they ate, half of it, and they are not so desperate that they're breaking down their fat for glucose. And if you don't break down fat, you don't get ketones, and you damn sure don't get fatty acids. That's why this guy's in acidosis, because he broke down fat into fatty acids. Okay? Kussmaul's, what is that a symptom of? Say it again.
No. Respiratory compensation.
Kussmaul's is a symptom of metabolic acidosis. It's compensation. How would you describe Kussmaul's to a new nurse? Where's my belt? Say it, baby. What'd you say? Thank you. Rapid and deep. Ain't got shit to do with fruit yet. We just wanted you to describe the breathing now. So if I say to the new nurse who asked me in her annoying way, what's Kussmaul's? Rapid and deep breathing. Now, the other symptoms, if you look on here, you guys are absolutely right. They have fruity breath and cherry lips. What's it from? What gave them that? Ketones. Good job. Okay, they're nauseous and vomiting. Why? Because they're acidotic, and that's how you get rid of acid. Vomit it up. Okay, sound like y'all jamming, but here we go. It sounds like the other person on the other side ain't got shit. You got a bunch of nuns and nevers and no's and all that. Normals, and this person has something much worse. I want you to write it and quote me. Profound osmotic diuresis. Profound osmotic diuresis. That patient got profound osmotic diuresis. How much? Well, good 10 liters in a day. They're peeing out a good 10 liters in a day. The other patient has polyuria, but not as profound. Now, the other thing with this HHNS, please write it down. Your patient's bicarb is greater than 20. The bicarb is greater than 20. And 50% will die. It's a lot of people. And the reason why they die is because with such osmotic diuresis, it's going to end up being no perfusion. Because wouldn't you say their blood pressure is what? Low. Because what controls blood pressure? Volume. No BP, no PP. So now they're going into kidney failure. There's no perfusion to the kidneys. And it's going to get worse. Okay. Now, both of these patients have this. Both of them. And I put it in the middle between them both. Both of them are warm and dry. What's our rhyme? Warm and dry means you're high. Warm and dry, sugar's high. Cold and clammy, give them candy. Okay, so they're warm and dry. Your first nursing action is the same with both of them. What is it? Hydration. Very good. With what? Normal saline. Okay. What kind of fluids is that? Isotonic. Mm-hmm. Sound like you got a clue. When we do insulin, what kind do we use? Regular, and we put it on a insulin pump. Yep, you got it. Okay, that's the difference between the two. Let's take insulin pump. Insulin pumps. You gotta know this one. It's not bad. Let's give you the insulin pump. When a patient has an insulin pump, do they gain weight or lose weight? Gain weight. Make sure you know it. How often do we change the needle? Oh, you want a page? Yeah, use that one. That's good. Type 1 diabetes. Put insulin pump on there. Type 1 diabetes, second or third page in the packet. She in the bathroom with her cheeseburger and shit. There you go. She going to the bathroom with her food with her crazy self. Okay, so use that page for a little insulin pump information. Okay, now, so we said she gains weight. How often do you change the needle? 72 hours, which is 3 days. Wonderful. Does she have more DKA or less? More. Why? Good. She does not know that her pump broke. I told you about my student. She kept running back and forth to the bathroom every damn half hour, if not more. So finally I got tired of it. Not that she was bothering me, but I know she's got an insulin pump, and I know she's a diabetic, and I'm thinking polyuria, right? That's what you should think, because you're a nurse to the day you die. I said, what's going on with you? Is your pump working? It had stopped working probably around 2 o'clock in the morning. So by now, my class, right, 9 o'clock, she's running back and forth, running back and forth, running back and forth, running back and forth. What the fuck? Polyuria. She would have gone into DKA if she continued to go throughout this day like that. So they have more DKA, but less. What's less? What's less in this patient? They have more DKA, but less. The opposite. That's what they have. Hypoglycemia. Which one's worse? Exactly. So they have much better outcomes because they may have more DKA, but they have less hypoglycemia. And it's the hypoglycemia that will kill you. Does it matter when they eat? No. It's continuous. So more flexibility in eating. Does it matter when they exercise? No. More flexibility with exercising. Hooking y'all up. Hope you're writing it down. Do they check their blood sugar more or less? More. 6 times a day. And check the blood sugar more. Overall, they use less insulin. And the downside is it's expensive, and you may have a hard time getting it approved. It is expensive. You may have a hard time getting it approved unless the nurse has done a really good job of keeping record of the admissions to the hospital, the ER visits, the log. Okay, so I'm going to try that again. Listen to me. Make sure you check your list. More DKA, less hypoglycemia, more weight gain, more flexibility in mealtime and exercise. Change the needle every 3 days. You have something called a basal dose, which is continuous, and a bolus for meals. You have a basal dose, which is continuous, and a bolus for meals. You ain't got to calculate nothing. So it's kind of nice. Okay, so you have a basal rate, which is continuous, and a bolus for meals. And the reason why the patient has more DKA is because they may not know their pump stopped working. But hypoglycemia is worse. Okay, mixing insulin. I teach you a simple step. Begin and end with NPH. Begin and end with NPH. That clear to cloudy shit don't work. So here we go. We put the air in the NPH first. The reason why clear to cloudy doesn't work, because if you think about clear to cloudy, you put the air in the cloudy. So you would be all screwed up, and that's why people get this wrong. So you put the air in the NPH first, then you put the air in the regular, you keep the needle in the vial, and flip it. Take out the insulin, take out the NPH. Air, air, insulin, insulin. Begin and end with NPH. Done with that. Nancy Reagan, RN. I like that. Okay, self-monitoring of blood glucose technique. Where do I stick my fingers? And what do I do before I stick my finger? Clean it with alcohol and milk it, huh? Warm it, yep, warm it, especially if it's a baby, you warm the heel. But for the grown-up, you're using the sides because they have less nerve endings. Hurts a lot less to use the sides. Warming it up, milking it, alcohol, yada, yada, yada. Hemoglobin A1C diagnostic for a diabetic, what is that? Good. That's diagnostic for diabetes. What is the goal? To keep them less than 7. Excellent. What are you and me if we're not diabetic? 5. We better be. 6 is borderline, right? I mean, remember, you're pre-diabetes. Fasting blood sugar needs to be less than. I ain't heard it yet. Know this for the rest of your life. Fasting blood sugar is less than 100 is normal. Between 100 and 126 is pre-diabetes. After 126 is suspicious for diabetes. So you do care about pre-diabetes. Between 100 and 126, fasting blood sugar is suspicious for diabetes. Less than 100 is normal fasting blood sugar. Okay, random. Random means it doesn't matter when you did it. You could have did it with a meal, after a meal, before a meal, doesn't matter. Random. What is suspicious for diabetes in a random blood sugar? 200. Random blood sugar, any given day of the week, is suspicious if it's greater than 200 or equal. Okay? Now, don't worry, because what I gave you is already in there. Okay? It's just all that shit is in there. Matter of fact, turn to the most important page and put bunny ears or flip them back or something. Turn to the page that looks like this, and then bend your little page back. This is the test. This is your type 2. Put a little, bend the page back, do something. Find that lady eating them chocolates. And look at the bottom, over on the right-hand side. Okay? And the left. Do y'all see? Those are the bomb. That's the most important page in the packet outside of that one I typed for y'all. Boom, that's all your laughs I just went over 2 seconds ago.